Hello everyone, I'm Dr. Nitin Tiwari. I'm a senior interventional cardiologist working at Wokhad Hospital since last 1.5 decades. And today is World Heart Day, and it is generally celebrated on 29th of September just to create awareness about heart diseases. And now one of the hot topics is why people are dying, why young people are rather dying because of working and workout in the gym or doing marathons. You might have read in the newspapers, many of the people have died because of exercise. So now I just want to demystify this thing that if you look at exercise, exercise has a bell-shaped curve. You might all have heard that anything in excess is poison. So don't do excess. A moderate activity, 30 minutes per day, maybe most days of week, maybe 5 days, that is 150 minutes of moderate exercise is good enough to keep your heart healthy. And I believe anything over than that, like doing a marathon when you are not trained for it, or over-exerting, cycling, for 200 kilometers, lifting heavy weights unnecessarily just for the social media. I don't think it's a thing to be done nowadays. Because see, exercise, it has its own pitfalls. Like if there is a rapid exercise, there can be something called as plaque rupture. There are a lot of hormones which are secreted like adrenaline, noradrenaline, stress hormones. So they get secreted and they can cause sudden cardiac death. The plaque rupture can actually lead to an MI. What is plaque rupture? Plaque rupture is the blockage which gets ruptured because of the thin fibrous cap. So it can happen with anybody. So ideally, don't overdo. But don't be scared of doing exercise also, because see, moderate exercise is always preventive and it is always good for heart. Apart from the sudden deaths, now there's no age as such which is now safe from heart disease. I've seen people as young as 17 years, 23 years. I've done many angioplasty in such patients. So if you have a family history of heart disease, like 55 years or less, if somebody's young blood relative is having heart disease, then you are at higher risk. Get yourself checked.